Stop drinking your olive oil in the morning. If you've been told to take it with breakfast, on an empty stomach, mixed into your eggs, I need you to hear this before you do it again tonight. Because what your body does with that spoonful after the sun goes down is almost nothing like what it does with it at 7 in the morning. And once you understand why, you're going to look at that little glass bottle in your kitchen completely differently. I'm Dr. Margaret Wilson, a physician, and I've spent the better part of my career working with patients over 60, watching what actually changes in an aging body, not what we wish would change, not what the supplement companies promise, but what really happens at the cellular level once you cross 60, 70, 80 years old. And one of the most consistent, most overlooked findings in the research on healthy aging populations, particularly in long-lived communities around the Mediterranean, is that the people who live the longest, who stay the most independent, who keep climbing stairs and gardening, and dancing at 90, share a quiet little habit that almost nobody talks about: a spoonful of olive oil, taken at night before bed. This isn't folklore. Researchers studying populations in places like Sardinia and southern Greece, regions with some of the highest concentrations of centenarians on Earth, have long pointed to olive oil as a defining feature of the diet. What's less talked about is the timing. And timing, especially after 60, changes everything about how your body uses what you give it. Before we go any further, I want to ask you something. And I mean this, I read every single comment on these videos. Every one. So tell me in the comments right now, how old are you, and what's the one part of getting older that's been hardest for you to accept? Is it your joints? Your energy? Your sleep? I want to know who's actually watching this, because everything I'm about to tell you I'm going to tailor toward people exactly like you. Now here's what I want to tease before we dive in, because I don't want you clicking away before you hear it. Number 2 on this list today is something that, when I first read the research on it years ago, made me sit back in my chair, because it directly involves your brain's ability to clean itself out while you sleep. And almost no doctor explains this to patients over 70, even though it might be one of the single most important things happening in your body at night. So stay with me, because we're counting down from 5. The body system's olive oil touches in a way that becomes more and more critical the older you get, and we're building toward that one. Let's start at number 5. Number 5. Your joints, and the quiet inflammation that's been building in them for decades. Here's the dramatic truth nobody tells you when you're handed a diagnosis of just arthritis. What you're actually experiencing is a slow-burning inflammatory fire that's been smoldering in your joint tissue for years, sometimes decades, before the pain ever showed up. Researchers studying olive oil have identified a compound in it called oleocanthal. And what's remarkable about oleocanthal is that it behaves in laboratory studies in a way that's structurally similar to ibuprofen. It works on some of the very same inflammatory pathways that over-the-counter pain relievers target, just at a much gentler intensity. Think of inflammation in an aging joint like rust slowly building up inside a hinge. You can't see it from the outside, but every time that hinge moves, it grinds a little more, wears a little more, until one day the door barely opens. Oleocanthal acts like a slow, steady drop of oil into that hinge, not flooding it, not forcing it, just quietly reducing the friction over time. Why does this matter so much more after 60 than it did at 30? Because your body's natural anti-inflammatory response weakens with age. Younger bodies are remarkably good at resolving inflammation on their own once it's done its job. Aging bodies tend to leave the inflammatory response running long after the threat is gone, like a smoke alarm that won't stop beeping even after the smoke is cleared. That lingering low-grade inflammation is part of why joints that used to bounce back overnight now ache for days. Taking your olive oil at night matters here because your body does the bulk of its tissue repair during deep sleep. And having anti-inflammatory compounds circulating during that repair window means they're available exactly when your joints are doing their quiet overnight maintenance work. For preparation, you want extra virgin olive oil. Specifically, the extra virgin label matters enormously here, because that peppery, slightly bitter taste at the back of your throat when you swallow it is actually a sign of higher oleocanthal content. The smoother, blander oils have been processed in ways that strip much of this compound out. A single tablespoon taken about 30 minutes before bed is the timing most commonly recommended in traditional Mediterranean practice. And here's your synergy tip for this one. Take it with a small piece of something containing vitamin C, like a few slices of orange, or a small glass of diluted lemon water, because vitamin C appears to help stabilize some of the delicate compounds in olive oil, protecting them as they move through your digestive system. I think of my patient Carol, 74 years old, from a small town outside Spokane, Washington. Carol came to me convinced her knees were simply done. Her words, not mine. She'd resigned herself to a cane, and had stopped gardening, the one hobby that had defined her retirement. We talked about her diet, made some adjustments, and added the nightly olive oil habit alongside other changes. 8 months later, Carol walked into my office without the cane, told me she'd put her tomato plants in herself that spring, on her knees in the dirt, and gotten back up without help. I'm not telling you olive oil alone did that. I'm telling you it was part of a pattern that together changed her life. Number 4, your heart. Specifically the flexibility of your blood vessels, which is something almost nobody explains correctly. When most people think about heart health and aging, they think about cholesterol numbers on a lab report. But there's something more fundamental happening underneath those numbers, and it's about whether your arteries can still flex. Think of a young healthy artery like a fresh garden hose, flexible, able to expand and contract with each heartbeat, absorbing the pressure smoothly. Now think of what happens to a garden hose left out in the sun for 20 years. It stiffens, it loses its give, and pressure that used to flow through it smoothly now causes it to strain at every pulse. That stiffening process in your arteries is called arterial stiffness, and it's one of the most significant, underappreciated drivers of rising blood pressure as we age. The monounsaturated fats in olive oil fats that, unlike the saturated fats found in butter or fatty meats, remain fluid and flexible at body temperature, appear to support the flexibility of the cell membranes lining your blood vessels. There's also the polyphenol content in olive oil, plant compounds with antioxidant properties, which researchers believe help protect the delicate inner lining of your arteries from oxidative damage, the same kind of slow chemical wear and tear that rusts metal left out in the rain. Why nighttime specifically? Because blood pressure naturally drops during healthy sleep in a pattern researchers call nocturnal dipping, and in aging adults this dipping pattern often weakens or disappears entirely, contributing to higher cardiovascular risk. Supporting vascular flexibility before this nighttime window may help support a healthier overnight pattern. For preparation, the same tablespoon of extra virgin olive oil works, though some of my patients prefer warming it very slightly, not heating it, just bringing it to room temperature if it's been refrigerated, since cold oil can feel harsh on an empty stomach late at night. And your synergy tip: pair it with a small handful of walnuts a few hours earlier in the day, since the omega-3 fats in walnuts and the monounsaturated fats in olive oil appear to work through complementary pathways for vascular health. This is a good moment to pause, because I want to ask you for something, and it costs you nothing. If you've made it this far, please hit that subscribe button and tap the like on this video. I make these videos because I want people your age to have real, honest information instead of marketing. And the only way YouTube shows these videos to more people exactly like you is if you tell it to, with a simple like and subscribe. It takes 3 seconds, and it genuinely helps. Now, let's keep going. Because numbers 3, 2, and 1 are, in my opinion, the most important things we're going to talk about today. Number 3, your gut, and the trillions of microscopic residents living inside it that most people over 60 have never properly considered. As we age, the diversity of bacteria in our gut, what researchers call the gut microbiome, tends to narrow. Think of a thriving rainforest with hundreds of species slowly turning into a single crop farm field. A diverse gut microbiome in younger adults supports digestion, immune function, and even mood regulation, but that diversity often shrinks with age, partly due to changes in diet, medication use, and reduced digestive enzyme production. Olive oil's polyphenols appear to act like fertilizer for some of the most beneficial bacterial species in your gut, particularly certain strains associated with reduced inflammation throughout the digestive tract. There's also a simpler mechanical benefit. Olive oil has a natural lubricating effect on the digestive tract, which matters enormously after 60, when slower gut motility, the speed at which food moves through your intestines, becomes increasingly common and contributes to the constipation so many seniors quietly struggle with but rarely mention to their doctors. Taking it at night specifically gives it hours of uninterrupted time to move through your system overnight, working gently while you sleep rather than competing with a full day of meals, coffee, and medications. For preparation, a tablespoon taken on a relatively empty stomach, ideally an hour or two after your last meal of the day, allows it to move through your system without being diluted by other foods. And the synergy tip here: a small amount of fiber earlier in the evening, a few bites of cooked vegetables, or a small serving of oats, gives the beneficial bacteria something additional to feed on, working alongside the olive oil rather than against it. I think of Harold, 68, from a suburb outside Cincinnati, who'd lived with what he called stubborn insides for 15 years, relying on over-the-counter remedies that worked less and less over time. We introduced the nightly olive oil habit, alongside a few small fiber adjustments to his evening routine. Within 6 weeks, Harold told me, almost embarrassed, that he hadn't felt this regular since his 40s. Small changes, given enough time, can produce results that surprise even the patient. Number 2. Your brain, and specifically its ability to clean house while you sleep. The thing I promised you at the start of this video. Here's something most people never learn until much later in life. Your brain has its own built-in cleaning system, a network of fluid channels that wash away metabolic waste products that accumulate during the day, including a protein called beta amyloid, which has been studied extensively in relation to cognitive decline. This cleaning system is dramatically more active during deep sleep than during waking hours. Think of it like a building that only runs its industrial cleaning crew after hours. Once the offices are empty and the crew can work without anyone in the way. The problem is that as we age, both the quality of our deep sleep and the efficiency of this overnight cleaning system tend to decline, which researchers believe may be part of why cognitive changes become more noticeable in later decades. Olive oil's polyphenols, particularly one called oleocanthal that we mentioned earlier, along with another called oleuropein, have been studied for their antioxidant effects on brain tissue, with some laboratory research suggesting they may help protect neurons from the kind of oxidative stress that accumulates with age. Beyond the polyphenols, the healthy fats in olive oil are simply good building material for your brain, which is by weight one of the fattiest organs in your body, and relies heavily on quality dietary fat to maintain the structure of its cell membranes. Taking olive oil specifically at night may matter here, because it's present in your system during the very hours when your brain's cleaning crew is most active, potentially supporting that overnight maintenance window when it matters most. For preparation, the tablespoon before bed approach remains the standard, though I encourage patients to take it roughly the same time each night, since consistency appears to matter for any habit tied to sleep architecture. Your synergy tip: dim the lights in your home for the 30 minutes before you take it, and go to bed. Since darker light supports your body's natural melatonin production, and melatonin itself plays a supporting role in that overnight brain cleaning process, so you're essentially supporting the same system from 2 directions at once. I want to tell you about Eleanor, 81 years old, from a small community outside Asheville, North Carolina. Eleanor's daughter brought her in, worried about her mother's increasing forgetfulness, misplaced keys, repeated questions, a fog that seemed to be settling in. We addressed several things together: her sleep schedule, her evening light exposure, and yes, the nightly olive oil habit, alongside other dietary changes. A year later, Eleanor's daughter told me her mother seemed sharper than she'd been in years, finishing crossword puzzles she used to abandon, remembering names she used to lose. I want to be honest with you, I can't promise this for everyone, and I'm not claiming olive oil reverses cognitive decline, but supporting the brain's natural overnight maintenance systems, through sleep, light, and nutrition together, is one of the most promising and least expensive things we can do for aging brains. And now, number 1. The single most powerful reason I believe a nightly spoonful of olive oil deserves a place in your routine after 60. Your muscles, and a phenomenon called anabolic resistance that almost nobody outside of medicine has ever heard of, yet it might be the single biggest threat to your independence as you age. Here's what anabolic resistance means, explained simply. When you're young, your muscles are remarkably efficient at taking the protein and nutrients you eat and using them to build and repair muscle tissue. But somewhere in your 60s, that efficiency drops. Your muscles become, in effect, resistant to the normal building signals that used to work effortlessly. Think of it like a delivery truck that used to drop packages right at your front door, but now the driver leaves them at the curb, then the end of the driveway, then eventually at the end of the street. The packages, the nutrients, are still arriving, but less and less of what you eat actually makes it into your muscle tissue where it's needed. This is a major contributor to a condition called sarcopenia, the progressive, age-related loss of muscle mass and strength that researchers consider one of the most significant threats to independence in older adults. It's the reason a fall that a 40-year-old would shrug off can become a hip fracture and a permanent loss of mobility in someone older. Here's where olive oil enters this picture in a way that surprised even me when I first read the research. Certain healthy fats appear to help reduce the inflammatory signals that contribute to anabolic resistance in the first place. There's also a mitochondrial angle here worth explaining simply. Your mitochondria are the tiny structures inside every cell that produce energy, often called the cell's power plants. As we age, mitochondria become less efficient and more prone to producing inflammatory byproducts. And that decline in mitochondrial efficiency is closely tied to the muscle loss we see in aging adults. The healthy fats and antioxidant compounds in olive oil appear to support mitochondrial membrane health, essentially helping these tiny power plants run a little cleaner, a little more efficiently, even as the years go by. Why nighttime specifically for this one? Because muscle repair and protein synthesis happen heavily during sleep, particularly during the deeper stages, and having anti-inflammatory, mitochondria-supporting compounds on board during that overnight repair window may give your muscles a better environment to do their rebuilding work in. For preparation, this is the one place I'll tell you timing and pairing matters most. Take your tablespoon of olive oil in the evening, ideally alongside or shortly after a modest source of protein at dinner, a piece of fish, some eggs, a serving of beans or lentils, because the fat appears to help with absorption of certain fat-soluble nutrients that work alongside protein in supporting muscle health. And here's the most important synergy tip in this entire video. Pair your nightly olive oil with a short bout of resistance activity sometime during your day. Even something as gentle as standing up and sitting down from a chair 10 times, or lifting light hand weights for a few minutes. Nutrition alone cannot rebuild muscle. It needs the building signal of activity to actually be used. The two together, the mechanical signal from movement and the nutritional support from healthy fats, appear to work synergistically in ways that neither one accomplishes alone. I want to tell you about Robert, 76, from a quiet neighborhood outside Tulsa, Oklahoma. Robert had grown afraid of his own stairs. He told me in almost a whisper that he'd started sleeping in a recliner downstairs because climbing to his bedroom had become frightening. His legs simply didn't trust themselves anymore. We built him a simple plan: a nightly tablespoon of olive oil with his dinner, a few minutes of chair stands each morning, and short, gentle walks. 4 months later, Robert sent me a message, just to tell me he'd slept in his own bed, upstairs for the first time in over a year. He climbed those stairs himself. That to me is what this is really about. All the scientific references for everything I've shared with you today are linked in the description below this video, so if you want to dig into the research yourself, or print it out and bring it to your own doctor, it's all there waiting for you. I want to leave you with something before you go. Getting older was never supposed to mean giving up your independence, your stairs, your garden, your own bed. Quality of life in these years isn't about chasing youth. It's about protecting what makes you, you. The ability to get up off the floor on your own, to remember your grandchildren's names without reaching for them, to walk into a room without fear of what your legs might do. A spoonful of olive oil before bed will not undo decades in a single night, and I would never tell you it could. But small, consistent choices repeated night after night have a way of compounding into something larger than they ever appeared to be at the start. It is genuinely, truly not too late, no matter where you're starting from tonight. If this video gave you something worth holding on to, please subscribe so you don't miss the next one, and hit that like button on your way out. It really does help more people exactly like you find this. And before you go, tell me in the comments which one of these 5 surprised you the most, and are you going to try it tonight? I'll be reading every single answer.